but we'll be hearing from them for an educational session about Pennie to understand the new insurance exchange in Pennsylvania. So let me explain just a little bit about Tri-County Health Council, if we can go to the next slide. So Tri-County Health Council is an organization formed by the Pottstown Hospital, Community Health and Dental Care, Creative Health Services, and the Pottstown Area Health and Wellness Foundation, originally formed by those four organizations, with the Tri-County community, the community network being added to the organization recently. And these five organizations and the leaders of these five organizations formed the board of the Tri-County Health Council. So we welcome those board members to this session, and we thank them for their leadership. The Tri-County Health Council includes those five organizations plus a number of other community-based organizations that meet the health and social service needs of the communities in the Pottstown area. And it's a really pretty unique organization because by bringing together these specific healthcare organizations and the community-based organizations, you're really addressing the organizations meeting the needs of this community and figuring out how to better meet those needs. And so the council meets on a monthly basis, and the members of the council discuss ways to improve care. There are 4 work groups that operate addressing different issues of need and interest in the community. So that's a little bit about the Tri-County Health Council. Let me go on to introduce the speakers today. So we're very excited today to be able to hear from Scott Yeager, who's the outreach manager for Pennie, the new Pennsylvania Health Insurance Exchange. And he will explain the exchange and explain what you all need to know as both as individuals, but importantly as professionals in the health and social services world in this community, so that you can help others within your organizations, within the community, understand the insurance exchange. And David Buono is the senior advisor to Insurance Commissioner Jessica Altman. So all of this happens within the insurance department in Pennsylvania, and he will describe the protections really that the insurance department provides and the role of the insurance department, so everyone has that perspective on the work that that is being described today. So I was hoping I would finish all of those introductions in 5 minutes instead of 15, which I did. So we can now jump quickly to the presentation, more time for the wonderful information. And I will turn things to Scott.
All right, thank you so much. And I will turn things over to David. He'll be addressing the group first, but thank you again for everybody showing up this afternoon. We have a lot of exciting information to share with you.
And one point of order, please. The Q&A is live, so please type in any questions you have along the way in the Q&A box, and we'll answer them as we go.
All right, thank you all so much for the great introduction. Thank you, Scott, for manning the controls. I do appreciate that. I know that is not always the easiest of jobs. On behalf of Commissioner Jessica Altman, thank you for inviting the insurance department to be here today. So Scott and I really have 2 topics for the agenda: who the insurance department is and talk about Pennie. So first, what we're going to do is talk a little bit about who the insurance department is. All right, so who are we? The department was first established under the Act of Assembly of April 4th, 1873. Believe it or not, when I ask folks when the insurance department was formed, I've heard 1976. I've heard, we're actually one of the oldest state agencies here in the Commonwealth. So April 4th, 1873. Our mission is to promote a regulatory environment that encourages a competitive marketplace and serves the best interest of insurance consumers. As I mentioned, we are led by Commissioner Jessica Altman. Okay, so what do we do? We actually regulate the 5th largest insurance market in the country and the 14th largest insurance in the world. So we have a pretty big job here in PA. We provide a fair regulatory environment that encourages insurance companies to conduct business in PA. We provide safeguards related to the solicitation and sales of insurance products and services. We review and approve insurance policy language and insurance rates. And we license insurance companies and producers, who a lot of you all on the call know as agents. So we license those folks. So that means we oversee approximately 1,700 insurance companies here in the Commonwealth. We currently license about 260,000 producers. We review approximately 12,000 rate and policy forms every single year. And we handle 250,000 consumer and producer interventions and inquiries annually. And finally, last year, we handled approximately 12,329 complaints, answered 46,993 phone calls, and actually got a total restitution of about $98 million. So we do a lot of great work. And the amazing thing about the insurance department is a lot of folks don't know that there's a regulator that watches over insurance companies. There is. And we're here, and I'll give you some information on where to go to get help. So one thing that we do is we help to educate people about insurance. All of these booklets right here that you're seeing the beautiful pictures of are different things that we've created to help explain insurance. So just to be sure that you know, we're not just regulators of health insurance. We're also regulators of auto and home and renters, annuities. So it just doesn't stop with health insurance. So we are here to help you if you need us. All right, Scott, ready for the next one? Now, the next slide right here, this one's kind of important because I think this is where a lot of folks can get confused. So believe it or not, health insurance is kind of in pie form. So you'll see here that the percentages represented on the chart are based on the population of approximately 13 million people here in Pennsylvania. The chart, the large chart is representative of the overall marketplace. So as you can see, the orange section represents health coverage benefits provided by Medicaid and CHIP. That's about 20%. And as you know, Medicaid and CHIP are state and federal programs, and they provide health care coverage to eligible individuals, whether it be through financial status or being with CHIP for children. The green section represents Medicare. That's also about 20% of the population. The health insurance coverage is a federal program governed by federal laws through the Centers of Medicare and Medicaid Services. The purple section, which is the real important section to Scott and I, is the section that represents the uninsured. So, you know, our goal is to have as many people in the Commonwealth insured as possible. That big yellow section of the pie, that is commercial self-insured marketplaces. That's about 30%. A plan is self-insured when an employer assumes the financial risk for providing healthcare benefits to their employees. Self-funded plans are regulated by the federal government and through the Federal Department of Labor and Industry. That's actually not regulated by us. And actually going back, Medicare is not regulated by us, and Medicaid and CHIP is not regulated by us. So, you know, which part do we regulate? Well, that's the blue part. That blue section represents about 20% of the population. That is commercial insurance, which is now through Pennie. It's comprised of individual, small group, and large group health plans, and is broken down in that smaller blue piece of pie. These commercial insurance plans are regulated by the Pennsylvania Insurance Department and governed by both federal and state laws. So within the market, there's 20% of the population purchase individual health insurance for coverage through that. So you can get that through Pennie. And then you'll see that we have small group health insurance coverage, which is small businesses that employ up to 50 individuals. And within that commercial group, you'll see that there's a large group health insurance, and that is for people, for the employer with 51 or more employees. So the large group market is about 14% of the Pennsylvania health care market. So Scott, go ahead for the next. Thank you. So what I want to make sure, I know I went really quick, but I really do believe that the information that Scott's about to bring is the most important part of the presentation. And as a regulator, we usually like to kind of hang out in the background. We're not usually the flashy folks that want everybody to know us, because we're making sure that folks are doing the right things. And that's why we're here. We're not here for that fame. We're here to make sure everybody's doing the job they're supposed to be doing. But if you need us, you can visit our homepage at insurance.pa.gov. If you need to file a complaint, if you feel your insurance company isn't doing something right, you can absolutely do that by going to file a complaint, which is on our homepage. You can also call our Consumer Services Bureau at 877-881-6388. We are on Facebook and Twitter, so right there's our links. We do make some pretty cool health insurance videos. We try to do our best to educate folks about insurance and about where to go for help. So be sure to check out our webpage. Now, I'd like to hand it over to Scott to talk to us all a little bit more about Pennie. Scott, it's all up to you.
All right. Thank you so much, David. And again, thank you, each and every one of you, for taking time out of your schedules to learn a little bit more about the Department of Insurance here in Pennsylvania, and about Pennsylvania's newest agency, Pennie. I'll start with our name. PENN is Pennsylvania, I is insurance, E is exchange. We went with Pennie because our official name is the Pennsylvania Health Insurance Exchange Authority. And if you say that a few times real fast, your tongue is going to seize up. It's not going to be pretty. But what I'd like to do is take a moment to introduce you to who we are. And I'll start with our origin story. Pennie is good for all Pennsylvanians, because our legislation that gave birth to us was akin to a blue moon in Harrisburg, Pennsylvania. Pennie was created out of a desire to bring health insurance in the individual market home to Pennsylvania. Why? Because in 2018, the Commonwealth of Pennsylvania had sent back to healthcare.gov about $98 million. Okay. There were a group of legislators and very, very forward-thinking policymakers, including Commissioner Altman, who got together in Harrisburg and said, you know what, we can do this better, and it won't cost the Commonwealth of Pennsylvania a dime more. So what happened was, through a unanimous bipartisan effort in both chambers of the Pennsylvania General Assembly, Pennie was given birth and was signed into law by Governor Wolf on July 2nd of 2019. We actually got two programs out of one. The first thing that we got is Pennsylvania now has its official and customized health insurance exchange. We are no longer affiliated with healthcare.gov. If someone in the Commonwealth of Pennsylvania who's in the individual market wishes to purchase health insurance, they can come directly to Pennie. If they go to healthcare.gov, which we have a very good relationship with CMS, healthcare.gov, they will, encourage them to go and redirect them to pennie.com. That brings up a good point, pennie.com. We're pennie.com, not pennie.gov, not pennie.pa.gov. Our research indicated that for us to succeed in helping insure those individuals that, David had just mentioned before, about 5.5% of Pennsylvania's population is uninsured. In order for us to best reach them, we needed to be in a position where we were approachable, where we were, accessible. And that's something that I think you'll see here as I go forward. But the second thing that we received out of the legislation was a reinsurance program. That reinsurance program is very important, because you can have the best health insurance on the planet, but if people can't afford it, or worse yet, if people can't afford to utilize it, you've got a boat on dry land. So the reinsurance program is established here in Pennsylvania to help provide, some support for the insurance carriers and companies here in Pennsylvania who provide health insurance, good health insurance in the individual health insurance market. That's Pennie.com. So we for the first time on October 15th of 2020, 16 days actually before Pennie's launch, which was November 1st of 2020, Commissioner Altman had a press release. And that press release announced that the individual health insurance rates and premiums in Pennsylvania had decreased by about 5%. So before we even launched Pennie, we were already making history and improving that accessibility and affordability for the residents of Pennsylvania. I'd like to brush upon who we are and what we do. We are, again, the official health insurance marketplace for Pennsylvania. In addition to and these are important things, in addition to the reinsurance program that helps keep rates and premiums reasonable for our customers, Pennie also created a marketplace with the idea of, making sure that it was a competitive marketplace, that people had options. When there's competition in the marketplace, it's good for business and it's definitely good for customers. So those are two important things that came out of our legislation and the advent of this exchange for the Commonwealth. The second important thing, and this was something that transitioned over from healthcare.gov, and that is Pennie is the only source for financial assistance in the individual health insurance market. A lot of times I get asked the question, well, what's the difference between me going to Pennie or me going to, Independence Blue Cross or Capital Blue Cross or UPMC or Highmark or Geisinger directly in purchasing my insurance? Here's my retort to that. If you're going to them to purchase your insurance, phenomenal. That's excellent. Again, our goal is to make sure that people in the Commonwealth of Pennsylvania are protected. The advantage of coming to Pennie is that we have got financial assistance. Okay. And all of our health insurance plans meet the 10 minimum essential requirements that are set forth by the Affordable Care Act. So we don't sell junk insurance at Pennie. We sell good quality insurance that will help people stay protected and protect their quality of life. A couple things to keep in mind is that Pennie, when we talk about who we are here to serve, we are most definitely here to serve the uninsured. But we're also here to work with sole proprietors, small business owners, small precision manufacturers who, might not hit that golden number of, that they need to qualify for a group benefit plan. Or they may be in a position where, as a sole proprietor, they don't work for somebody. So they work for themselves. And there are a lot of gig workers right now. People who are working, in some cases, a couple jobs or maybe even 3 jobs, just trying to make their way. In many cases, they won't qualify for health insurance through their employer. If an individual does not qualify for health insurance through an employer, if they do not qualify for Medicaid, more on that here in a minute, or they're not, of the age yet where they would be able to take advantage of Medicare or Medicare options or supplements, that's why Pennie's here. We're here to make sure that those individuals have options and that those individuals have choices. I'm going to circle back here real quick and talk about Pennie's no wrong door policy. And this is significant. As a resource for the Commonwealth of Pennsylvania, Pennie has a singular goal, and that is to make health insurance and dental insurance affordable and accessible. At the end of the day, we want to protect people. Okay. So when individuals come to Pennie, if it's determined that that individual is qualified for Medicaid, if they're working with one of our customer service representatives, and I'll get to that here in a second as well, the customer service representative at Pennie will warmly, person to person, transfer that individual who is eligible for Medicaid directly to their county assistance office, person to person. Why is that important? It's important because providing somebody with a resource number, patting them on the back and wishing them well, generally results, especially with something like health insurance, it results in somebody finding something far more interesting to do in their day than, follow up on a health insurance lead. So we want to make sure that people get protected when it's on their mind, when it matters to them. So that's the reason we have this no wrong door policy, and it's something that we take very seriously. But it's not just Medicaid. We have individuals who they may qualify for, Medicare supplements, and those types of options. We have Pennie certified brokers that we can connect them to in their local area that can help them explore those options. Also, if somebody comes to us and they qualify for veterans benefits, we want to make sure that they get connected to the VA the right way as well. But that brings me to how Pennie supports our customers. And there are 3 levels of support for, technically, if you consider the fact that Pennie.com is a no pressure, no hassle environment for people to shop for health insurance. And I'll show you a little bit about that here in a moment as well. But we have 3 layers of help at Pennie that will support customers and community partners like you, who you might encounter somebody who who may need health insurance or dental insurance. And if that's the case, you can refer them to Pennie.com, but you can also refer them to our customer service team. Okay. 844-844-8040. I'll show you that number again. Don't worry. But our customer service center, again, these are individuals that do not work for insurance companies. They work for the residents of Pennsylvania. They are here to serve, no pressure, no hassle, and they provide unbiased, unfiltered education and guidance for our customers. They can work with an individual from the moment of initial inquiry all the way through determining financial assistance eligibility, exploring and comparing plan options. They can even help them right over the phone secure the insurance that they need. We also have online self-service, again, as I mentioned, through Pennie.com, direct outreach and education, which myself and my partner Juan Valencia do throughout the Commonwealth of Pennsylvania. If your organization or if a partner organization of yours in the community would, want to have a virtual education session like this one, please don't hesitate to reach out. We're very committed to connecting with the counties that are in your region, and I'll show you why here in a second. But we also have in-person and virtual assisters, Pennie certified assisters and brokers throughout the Commonwealth of Pennsylvania who can, again, provide that level of community connection that people need and quite often prefer over doing business over the phone. I had mentioned the need for education and outreach. This heat map represents the uninsured in Pennsylvania. There are about 607,000 uninsured in the Commonwealth of Pennsylvania. That's about 1 in 20 of our friends and neighbors. 1 in 20. We are in 2021. There has to be a way that we can connect and help these folks get protected. You can see that about 36% of our uninsured population resides in 5 counties: Philadelphia, Delaware, Chester, Lancaster, Montgomery, Bucks. In those areas, we're talking about significant numbers of uninsured. But that's not to say that it's unique to southeastern Pennsylvania. Of course not. Luzerne County, Allegheny County, Westmoreland County, Erie County. Really, there is no county in Pennsylvania where people aren't uninsured. like I said, our friends, our neighbors, sometimes the businesses that we frequent, they're making hard decisions um, about whether or not they should protect themselves and their quality of life. Pennie is here to help change that. And I've got some great news, some good news actually. But we'll take a look here specifically at Berks, Chester, Montgomery counties. The uninsured in total is about 78,000 overall. And here are some things that we know. The average person in these counties, both enrolled and not enrolled, is female, is white, is age 35 to 44, has a household income above 100,000. The uninsured demographic specifically, when we take a look at the uninsured in these three counties, the individuals are more often than not male, white, individuals that fall into the Hispanic and Latino ethnicity. It's about 2.5 times is likely to be of these individuals. They're 2.5 times likely to be Hispanic or Latino. Again, here's an age range that throughout the Commonwealth of Pennsylvania, we have 26 to 34. These are the young invincibles. These are individuals that think that, well, it'll never happen to me. There's a lot of education, a lot of wood to chop, so to speak, in that age range throughout our Commonwealth. With the uninsured, has a household income between 50 and 75,000. Again, is 2.5 times as likely to have an income that falls within about 138% of the federal poverty limit, and is 3 times as likely to have less than a high school graduate education. Now, when it comes to good news, we can take a look at the enrollee counts, and these enrollee counts are valid as of 5/17/21. Okay, just this week. Those within the foundation zip code, we have currently at Pennie 4,470 individuals. Those within the 3 counties, and again, this is county based now, not just based on zip code. This is county based. It's 50,393. Berks County, Chester County, Montgomery County. These are the current enrollees that we have through Pennie in Berks, Chester, and Montgomery. So that brings me to a question that we get often, and that is, when can I get insured? Well, one of the more important takeaways from today is Pennie currently has a COVID-19 enrollment period. It has been in effect since February 15th of 2021 and will remain in effect until August 15th of 2021. This particular enrollment period is significant because all Pennsylvanians have been impacted by COVID-19. Any uninsured individual can now come to Pennie and they can explore health insurance options, dental insurance options, and they can get insured and get protected. Any current customer at Pennie, they can also, through August 15th, they can come to us and change their plan. If they find that the one that they have just doesn't meet their needs anymore, if there's a change in their life status, and we'll get to that here in a second, we also made it so that individuals who are current customers can come to us and change their plans. And it also allows current enrollees to add an eligible family member. And the 7 steps that you see here, are literally as easy as it gets to 7 steps to getting covered and protected. And again, I stress, with our customer service representatives, with our assisters, and with our Pennie certified brokers, there's always help. There is always help. Individuals don't have to do this alone. A couple things that I wanted to reinforce here in terms of qualified life events. Right now, with the COVID-19 enrollment period, we have an open window for people to apply for health insurance until August 15th. Typically, every year, Pennie has an open enrollment. Our inaugural open enrollment was November 1st to January 15th of 2021, okay? But throughout it, in a normal time, throughout the course of the year between open enrollment periods, there are qualifying life events, and many of these gaining lawfully present status. That's a big one right now, especially with the number of individuals coming to the United States on student and work visas, individuals who are seeking a path to citizenship here in Pennsylvania, which is fantastic. That's a qualifying life event that triggers them an open window, a special enrollment period, to actually contact Pennie and get health insurance if they don't have it through an employer or, other ways. With regard to other events, loss of minimum essential coverage. We know a lot of people right now who are workers in transition. Those individuals, again, would be in a position where they would be able to connect throughout normal times. They would be able to connect with Pennie for, health insurance, the birth of a child, adoption, fostering, finding yourself in a position where your income has been drastically cut, relocation to or within the Commonwealth of Pennsylvania can be a qualifying life event. So, like I said, I wanted to hit upon these because right now, the open and the COVID-19 enrollment period is open. Okay. In normal times, though, as part of this process, I wanted folks to understand that we also have qualifying life events here at Pennie that can trigger an open window to help somebody get covered and protected. The most exciting news that I have to share with you today is related to the American Rescue Plan. It was signed into law by President Biden on March 11th of 2021, and it increases the amount of financial assistance available to Pennie customers, and it improves access to their care and coverage. A couple things I'm going to hit on here very quickly, and please understand these are significant helps to individuals who are seeking coverage here in Pennsylvania. The first thing that the American Rescue Plan does for Pennie is it provides a more generous tax credit for 2021 and 2022, okay, for individuals who normally would find themselves in a position where they were no longer eligible for financial assistance. And those individuals are for an individual, it would be someone who makes $51,000 or more a year, or for a family of four that makes about $105,000 or more a year. Those families and those individuals would normally not see any advanced premium tax credits through Pennie. This year they will. And I have a scenario I'll share with you. What we've done through the American Rescue Plan is they've capped the premiums and the income that's calculated into this. They've capped that income at 8.5%. And like I said, I have an example of that I'll show you. It literally provides help in so many ways for those who might not normally have it. The second thing that literally impacts so many in the Commonwealth of Pennsylvania is with regard to unemployment compensation. If you're an individual within the Commonwealth of Pennsylvania that in 2021, for at least 1 week, qualified for unemployment compensation, regardless of whether they sent you the payments or the money or not, you are in a position where through Pennie, you qualify basically for maximum advance premium tax credits. And to be quite honest with you, what you end up with is, if you're at our second lowest cost silver plan, $0 insurance is what you wind up with as your option, which is, if you're unemployed, that is just phenomenal. A couple other things I'm going to hit on real quick here that are important with regard to advanced premium tax credits in 2020. When the individuals go to do their taxes this year, if for whatever reason, they underestimated their income and basically, went over in their APTC, their advanced premium tax credits, this year they will receive forgiveness for that. Okay. Again, it's part of the COVID relief. Another exciting thing is Cobra. Now, this brings an important point. Pennie as an option in the individual health insurance market will always be here to provide an alternative to Cobra. Many of us know of friends or family members or folks in the community who, when they separate from their employer, they receive this Cobra letter in the mail. And for a lot of folks, that Cobra letter is, it's sobering to see how much employer-sponsored coverage costs. But that's the idea with Cobra. It gives you the ability to continue that employer-sponsored coverage, and in many cases, it's coverage that depending upon your health condition, can be significant. So a lot of people will opt to want to cover, to continue that coverage. The good news is that from April 1st to September 30th of 2021, qualified individuals for Cobra will receive a 100% subsidy for Cobra. Now, that brings up the question, what happens after September 30th? Well, I'm glad you asked. Pennie, actually, our board of directors has already established a special enrollment period for those individuals who will lose their employer-sponsored coverage through Cobra, the continuation of it. They'll lose that September 30th. Well, we already have a plan in place where we're going to help those individuals continue coverage through Pennie. So right now, with regard to the American Rescue Plan, Pennie has already implemented the first phase of it. And it was that phase that dealt with the first two bullet points that I mentioned to you. Number one, we wanted to make sure that individuals had that continued access to 2021 and 2022 to the more generous advanced premium tax credits. And second, anybody who's unemployed, we want to make sure that they, had the ability to go onto the Pennie application and just click, I have been unemployed, and it immediately calculates their financial assistance. So where we're at right now is we are moving through our COVID-19 enrollment period, and our COVID-19 enrollment period provides individuals, and this is also important for a lot of people, provides individuals, you'll see that there is the last day to enroll for June 1 is May 31st. Last day to enroll for July 1 is June 30. Basically, what we are doing here at Pennie is we are working through the month and providing people with, again, on May 31st at, 10:59 p.m., if you wanted to apply for health insurance through Pennie, you could have coverage in force the next day. That's significant. That, again, for a lot of people, that's life altering. With regard to our customer redetermination, the first bullet point, we have that in place right now. And again, I'll show you this through our comparison tool demonstration here soon. I'll be able to show you what that looks like and why it's so important as a tool to have to help people in the community. It's one thing to talk about savings. It's another thing entirely to show them that they can afford to protect themselves. Our customer redetermination is actually coming up at the beginning of June. And we're doing that as a way to help our current customers transition over to the savings that will be there through no action of their own. Our goal is to always make sure that our customers are provided the smoothest transition if there are transitions like this. And this is a very happy time for our customers. A lot of folks will be saving money, and that's always a very good feeling. Speaking of saving money, I had mentioned to you that I had some scenarios that I wanted to share with you that were based upon the American Rescue Plan. The very first individual I'd like to introduce you to is a 40-year-old from Philadelphia County. He makes about $19,000 a year. Prior to the American Rescue Plan, this individual would have paid about $66 a month for his health insurance. Now, through the American Rescue Plan, this individual pays $0 for our second lowest cost silver plan. We have 3 metal tiers at Pennie. We have bronze, silver, and we have gold. For our second lowest cost silver plan, our benchmark plan, he pays $0 for that. So before, he may have been at the bronze level, he can now move to a silver level coverage plan for $0. Saves him about $792 a year. Pennie, and my goodness, it is such a good time to help the uninsured get protected. Many of us know of couples or individuals who are retiring early. My very own brother, he wakes up and all the time he'll tell me, he says 62 in one day and I'm retired. So people are looking at time differently now, and that's not necessarily a bad thing. This couple is married. They're 64 years old. 64 years old. That means that they're 1 year shy of qualifying for Medicaid, Medicare, Medicare supplements, etc. They make about $77,000 a year. Now, this is absolutely life-altering. Prior to the American Rescue Plan, this couple, these 2 individuals would have paid $2,462 a month for their health insurance. Under the American Rescue Plan, their income, that $77,580 that you see there, is capped at 8.5%. Their new premium is $550 a month. Their savings is nearly $23,000 a year, $22,949 a year they save. That is absolutely life-altering for, again, a couple that is on a fixed income moving into their retirement years. That's significant. Here's a family of 4. This family of 4 is from Potter County. They make about $52,000 a year. Prior to the American Rescue Plan, they covered 4 people in their family for $285 a month. Now, again, you're looking at a savings that is substantial. Now it costs $87 a month to cover 4 people. That's about $20 a person. They save $2,376 through the savings that we now have through the American Rescue Plan. And of course, here's an individual from Lackawanna County who is unemployed. Again, she is right on that edge where she would have been over 400% of the federal poverty level before, would not have qualified for any type of financial assistance, but she's been recently unemployed and she's currently receiving unemployment compensation under Pennie. And again, as an alternative to Cobra, she would be in a position where she would have paid 364% or $364 a month, 8.5% of her income. Under the American Rescue Plan, again, second lowest cost silver plan, she's got $0, 0% of her income, and she's got $4,300 to put back into her savings so that she can, weather the time between positions. So with that being said, I would like to talk a little bit more about Pennie's customer service experience. Our customer experience is very important to us. Again, Pennie is the only source for financial assistance in the individual health insurance market here in Pennsylvania. The four scenarios I just shared with you should shed some light on that. With an advanced premium tax credit, Pennie, through our inaugural open enrollment, we saw our customer average was $515 a month saved, through our inaugural open enrollment. So again, along with our reinsurance program, along with the competition in the marketplace, not only was Pennie able to reduce the rates in the individual insurance market, but we were also able to offer financial assistance that was absolutely tangible. The advanced premium tax credit is something that many people qualify for. And again, I'll be able to show you that in greater detail in the website demonstration. We also have cost sharing reductions at Pennie, which if you align with a silver plan, again, we have gold, silver, and bronze plans at Pennie. If you align with a silver plan, you can qualify for cost sharing reductions that help with those things that, to be quite honest with you, unless you were born with an inherent knowledge of health insurance, they scare people to death. And those are things like copays, co-insurances, deductibles. Hey, if you remember back at the beginning when David showed you the educational materials that the Pennsylvania Insurance Department created, there are incredibly detailed and very excellent educational resources available through the Pennsylvania Insurance Department that help explain some of those things that scare folks and intimidate people, such as copays, deductibles, co-insurances. So please check out the resources there and at pennie.com. One of the things that I need to make sure everybody understands is we do not sell junk insurance plans at Pennie. Okay. I had met not long ago with a doctoral student at Villanova University, and she had mentioned to me that she has an assistantship or a fellowship. She was doing some adjunct teaching, but she didn't qualify for benefits. So she went and she purchased an health insurance plan from, an agent that, she thought would help if she ever got into an accident. Well, she got into an accident. She stepped on a nail. And at first she thought, oh, well, this is nothing big. She put a little bit of ointment on it and a Band-Aid and, well, it got infected. She went to the hospital. They admitted her to the hospital. Part of her foot needed to be amputated. And then, of course, there were follow-up visits, rehab, etc. She received an absolutely crippling bill in the mail related to these medical expenses. Long story short, all of Pennie's health insurance plans try and ward off those expenses by providing emergency service care, prescription drugs, maternity, newborn care, etc. You can't be denied coverage due to a pre-existing condition, and any individual under 26 can remain on their parents' plan. Again, as you see at the bottom here, we also work with the 800-pound gorillas in terms of health insurance and quality protection here in Pennsylvania. Quality health insurance, quality dental insurance, and it's accessible, very accessible. Here, yeah, go ahead.
Scott, there was a question in the chat. Can I interject that question?
Yeah, I was just trying to finish up with time, but yes, go right ahead.
Just it was whether any of the insurance plans cover the sublocade injection. I don't know.
Generally speaking, and I can show you that with these plans, it depends on the carrier as to what will be covered. And that's something that if you contacted the carrier about, the insurance carrier would be able to advise. Our brokers, our Pennie certified brokers, would be able to advise on that level as well. So from my perspective, I can say that those are the people I would start with in terms of getting an answer to that specific question. We also, yeah, go ahead.
No, thank you. I just the question came up, wanted to give the participants the chance for their questions to.
Oh, absolutely. I appreciate it. And again, we have the resources here to get answers to questions like that. I do know that with regard to those types of injections and certain things, you will have to, contact the carrier to make sure that things like that are included if that's a necessity. More on that here in a second. With regard to support here at Pennie, we have support structures that are free. All of our support is free. Our customer service representatives, and there's that number, 844-844-8040. You can reach out Monday through Friday, 8 to 6 p.m. We have Pennie certified brokers as well as Pennie certified assisters. Now, you just heard me mention the Pennie certified brokers in relation to that question about the injection. The reason being is because within the Commonwealth of Pennsylvania, Pennie certified brokers are the only individuals who are licensed to make a professional recommendation to a customer. Assisters and our customer service representatives, they're unbiased. They're unbiased and they'll provide you with education and guidance. However, if you need detailed questions answered, going through a Pennie certified broker, again, it's free. Going through a Pennie certified broker is definitely where you would want to start. Now, in terms of helping Pennie get the word out, we are brand new. As I mentioned before, our agency has only been around for, we've only been around for 6 months. 6 months. We need all the help we can get. There are a lot of people who just don't know who we are. Please, if you know somebody who's looking for health or dental, please recommend that they go to pennie.com. That's a great place to start. And you can do that with individuals or groups. And again, with groups, please know that we're always available for virtual or even in person. These days, we're fully vaccinated. We're here to help get the word out. So if education sessions are warranted, please don't hesitate to reach out. That's what we're here for. You can share us as well on social media. We're on Facebook, Twitter, and LinkedIn. You can also attend our outreach and education work group meeting. That's a meeting that takes place on the first Wednesday of every month at 2 p.m. in the afternoon, always. Okay. So please understand, you are most welcome to attend that. One last thing I want to hit on just real quick is the YMCA and Pennie have partnered for the Health Equity Tour of 2021. Pennie is actually sponsoring it. In fact, yesterday we were in Berks County, and we are going to be in Schuylkill tomorrow, Lehigh, Northampton, Bucks County, Montgomery, Chester County, very, very soon. So all that you would need to do for information is either email my office, or you could just go to pennie.com. We'll have all the events posted, or you could Google YMCA Health Equity Tour. But here's the thing. If you would like to stop out to any of the events that we're having in your area, don't hesitate. Don't hesitate to connect with us. We'll have a big Pennie tent. You can't miss us. So with that being said, I'm going to turn it back over to John. And again, thank you again so much, everyone. If you have questions, please don't hesitate to ask.
That's great. Yep, if we do, let's take a couple of minutes for questions, and then where we will head to, which we think will be really exciting, is a demo of the exchange website, so you can see how easy that is to use and get a little bit of a a feel for that from the expert, from Scott, on how to use that. So thank you, Scott and David, for that great information. That was really, really helpful. Questions from the audience? Feel free to unmute and ask a question if you're able to do that. I don't know, John R., are they able to unmute, or do they need to put it in the chat?
They're able to use the raise hand function, and we'll be able to hear them if they have any questions, so we can hear their voice
Excellent.
that way.
Great. So if anyone has any questions for Scott or David. So I'll start off with one. Just oh, I'm sorry, there is one from Myra Forrest. So let's go right to that one. What is the cutoff level of income to be eligible for these programs?
Myra, that's a very good question. With regard to our no wrong door policy here at Pennie, if we find that someone in talking with them, if we find that they, they fall within the guidelines that they would qualify for Medicaid as opposed to Pennie, what we would do is we would, warmly transfer them over to the county assistance office in their region, to make sure that they got the care that they needed. With regard to, cutoffs, if somebody is qualified for Medicaid, it's law. We have to connect them with Medicaid, okay? If that individual is denied Medicaid after that referral and they come back to Pennie, at that point, that's a qualifying life event, and it opens up a unique special enrollment period just for them. And we will be able to help them get connected with health insurance and financial assistance at Pennie. Now, another important question to follow up with on that in terms of income level cutoffs. You remember I mentioned the American Rescue Plan did away with that subsidy cliff, where for an individual, if you made about $51,000 or more a year, or for a family of four, if you made $105,000 or more, basically you didn't receive any financial assistance. Well, now that's changed. Under the American Rescue Plan, their incomes are capped again at 8.5%. So we can go in and apply advanced premium tax credit, financial assistance to those customers.
So Scott, the 400% of federal poverty level, was that the old model before the American Rescue Plan?
Yes.
Where the cutoff was?
Yes.
And now the cutoff is calculated differently and more generously under the American Rescue Plan?
Most definitely. And that is why we are so excited.
Yeah.
Yes. And folks, if it looks like I'm typing, I am, because I wanted to make sure everybody had my contact information. Again, my name's Scott Yeager. You got my email address, you've got my business cell phone. Don't hesitate to reach out to either of them.
Great. Thank you. Myra, any follow-up to that? Feel free to type in if you have an additional question there. And I will just add a question. So there's 5.5% of the population in Pennsylvania is uninsured, and that's a group that you're working on getting insured. And then there's another proportion that were in the federal program, the federal exchange program, prior to this year and Pennie beginning. What proportion of the population is that? How much of the population is already in the exchange transfer program?
Right off the top of my head, you're looking at about 380,000 individuals.
Okay. Got it. Thank you. And thank you, David, as well, for your contact information there. Any other questions from the panelists before we jump to the demo, or for the panelists? Aisha, does the PA insurance govern over medical assistance? Oh, I lost it.
Let me go up and look at the question. Hold on one second.
Yeah, I'm sorry.
This may be a Department of Human Services question that you have if we're talking Medicaid. Is that what we're referencing in regards to Medicaid questions? Because that would be the Pennsylvania Department of Human Services. I can't find the question for some reason.
Yep.
I'm sorry.
Yeah, it scrolled up a little. Does the PA insurance department govern medical assistance for children as well?
Right, that would be at one time in regards to CHIP, that was with the Pennsylvania Insurance Department, but a couple of years back, it transitioned to the Department of Human Services, which I believe makes a lot of sense, being that it's working with medical assistance and CHIP. Now, if you would ever have a concern and you just couldn't find where to go, you can always reach out and we'll try to help you get to the right people as well within the Department of Human Services.
Great, thank you, David. Last call for questions right now, although you can definitely pop questions in and we can take them during the demo as well. And I know some people may need to hop off now at once. So if you do need to hop off, thank you for attending, and thank you again to Scott and David for your outstanding presentation today. And if you are able to stick around, Scott will now lead us through a demo of the website and how you actually look around for information on it.
All right, thanks so much, John. And again, thank you to everyone. I would like to introduce you to Pennie.com. And again, part of the reason that we went with .com instead of .gov is because we wanted to emphasize a universality. We wanted to be a central resource, a centralized resource in the Commonwealth for anyone who had questions about health insurance. So again, this is Pennie.com. Just to point out some significant things. Number one, we are emphasizing the savings that have been afforded through the American Rescue Plan first and foremost, right here. And we have, videos here, both in English and Spanish, that can help educate individuals on what the American Rescue Plan means. Our COVID-19 enrollment period is also prominent here. One of the things that I want to point out is that we also make it very easy to connect with those Pennie certified brokers and Pennie certified assisters that I had mentioned. But here's another thing. We also recognize the fact that there are a lot of individuals who are, on a path to citizenship here in Pennsylvania. And if you go to Pennie.com and you look down here in the lower right-hand corner, you'll see that we have languages that we can readily translate Pennie.com into. So for example, we've got Spanish, we've got Mandarin, we've got Russian, and we've got Arabic. So I just clicked on Arabic. If you're working with a community partner who their first language is Arabic, it may help a lot in communicating with them about Pennie, about the reason that health insurance is important in their first language. So that's something that, and again, we have Spanish. You can do the same thing in Spanish. We tried as best we can, and over time we're going to build the languages out. So please understand if you don't see a particular language there, like Central Khmer or Tagalog, we're working on expanding our languages. So, but we started with the ones that our research indicated were the most prominent. Spanish most definitely is one we want to make sure that we hit on. But in reviewing Pennie.com, the one thing that I enjoy about this site is the number. Our customer service information is right here. Okay. It's very, very easy to get help. The scenarios that I just went over with you are listed here. And again, this is all done with the idea of helping people get beyond their fears and their apprehensions. You'll see that we have our events listed here as well. But one thing that I'd like to focus on, and again, here at the bottom, they can connect directly with customer service, brokers, assisters, etc. One of the things that I want to focus on is what I believe makes Pennie really, really awesome. It just does. It's this gold get covered button that you see here. Anybody can click on this. And if you're working with a community partner, I was actually at last week on Thursday, I was at one of our YMCA COVID-19 vaccination events, and I had a young man come up, and he, he said, "Are you the insurance folks?" And I said, "Yeah, we are." And he and I talked about the fact that, well, I have a pre-existing condition. I don't have insurance through work right now, but would I be able to get covered? Well, here is where I really love the work I do. I clicked on this browse for health and dental. Okay, I actually brought this up on my cell phone. This is Pennie's comparison shopping tool. I typed in his zip code, his date of birth, and his income. And long story short, I was able to show him directly that, number one, Pennie was no joke. Number two, that the protection that we provide through our insurance carriers is great protection. Long story short, he turned around, he took one of my cards, he took a brochure, he turned around, he walked away. And as he was walking away, the director of the YMCA was coming this way. And she came up to me and she said, "What did you just say to him?" And I said, "It's not what I said to him, it's what I showed him." He went from a position where, and quite literally, when he came up, he was very, very sheepish. This is providing Pennsylvanians with hope. That's what I'm getting at. Okay. So if somebody would be so kind as to provide me with the zip code in your area, I'd be happy to use that zip code as an example. There we go. Okay. I see somebody put that in the chat. Hold on a sec. Okay, here we go. All right, I got a couple zip codes here. First zip code that I got is from Christopher. Christopher is 19464. Okay, and I'm selecting a county. I'm gonna shoot for Montgomery. I guess we can change that later on if you want. There we go. All right. Now, in terms of date of birth, I'm just, again, making up, let's say October. October is a good month. Making up a fictitious birth date. All right. And for income, let's say about 27,000. Immediately when you type in this person's information, in some cases, it'll ask you to select county. Birth date, you can always change that. Please note that you can add a partner or a spouse. And here's the cool thing, you can add dependents too. In some cases, not everybody in the family would be in a position where they would need health insurance. Maybe the employer has a setup, and many employers do these days, where they'll cover the worker, but they won't necessarily extend that coverage to a spouse or partner, or to a dependent. So you can always add those here. But when I put the income in, the first thing that you saw here was see if you qualify for savings. That lit up. Okay, now this is important. Immediately we can click on that and we can see that this individual qualifies for $327 a month in advanced premium tax credit. They also qualify for cost sharing reductions, which help with those silver plans. But here's the thing, I want to ask you a question. Did I ask for a name? Did I ask them to create an account? Worse yet, did I demand that they create an account? Did I ask for social number? Did I ask for, email address, ability to send a smoke signal? None of that. We didn't ask for any of that information. This is truly an anonymous shopping tool. But it's also a great educational tool. We're going to go to next. And here, coming back to the question that we received earlier, that was related to, whether or not a certain shot was covered through the insurance carrier. This is where you can, from a health insurance perspective, up front, say, okay, well, my family doctor or my clinic, the people that I work with, and you can put down a doctor, you can put down a dentist here. You can search for a dentist. You can search for a facility. If a certain facility is one that you would want to be connected with, you can do that from here. Okay. Another thing that you can do is say, okay, well, how many times a year do you visit your doctor? Is it, is it 3 or 4 times, 5 times, 12 or more times? You can list that here as a consideration. And here is something that's also incredibly important. Ongoing monthly prescriptions. Okay. The ongoing monthly prescriptions we can have here. And again, these are, important as maintenance medications. This is where you can actually get into, looking for specific, specific medications that you would need. Okay. You can also, and I know I keep on, there's Novolin. Yeah. For folks who might need Novolin for diabetes management, there's a whole host of prescription drugs that we can put up here. But more importantly, what most folks are keenly interested in is what I'm about to show you. For this individual in Montgomery County, these are again, if we take a look up here, there are 41 health plans available to this individual in addition to dental plans. Okay. They qualify for $327 a month in advanced premium tax credit. They also qualify for cost sharing reductions. That financial assistance information always stays at the top so that people can see it when they log in. But you'll be able to see here that we've got, these are bronze plans, okay, that are $0 right now. We've got, right here, we've got a gold plan that's $53.83. We've got literally 4 pages worth of health insurance options that we can go through. Let me do something here real quick. I'm going to pull up the best of the best. We're going to take a look at our gold plans. Okay. Now you'll see that we've got gold plans here from PA Health and Wellness. We've got gold plans from Oscar, and we've got gold plans from Independence Blue Cross. Okay. Again, there are, and this is something that because of the American Rescue Plan, there are certain plans here. When was the last time you saw a 0 deductible? That's, again, this is good news. But we also qualify for cost sharing reductions. So we may want to take a look at the silver plans that are being offered. And again, we have AM Better, PA Health and Wellness, Independence Blue Cross, and Oscar. We have silver plans that we can compare here, and that's where we're gonna start with this, so that I can show you some of the comparatives here. All that you need.
Scott, as you're getting into that, I just want to interject one question that came up from a participant, which was the distinction between a broker and an assister.
Yep.
And maybe that fits into your description of going through this kind of information with a client. So how would a broker handle that? How would an assister handle that?
In terms of and hit me with that question one more time. In terms of brokers and assisters, how would they handle which situation?
Well, I just where you are in the process now, maybe the brokers would get into this, but the assister
Right.
wouldn't, or vice versa, or maybe they both get into it.
Yeah, no, actually, that's actually everything that I'm showing you right now this is something that a broker, a sister, a customer service representative, or a community partner of Pennie's can do.
Got it.
Absolutely.
Great.
Everything I'm showing you right now, a customer can do themselves. They can self-serve and do this.
And
Okay.
what would a broker be able to do that the others can't do?
Well, what a broker does that the others can't is they are the only licensed professionals in the Commonwealth who can say, again, when a customer has specific healthcare needs, when they have specific medical needs or needs for certain medications, okay, it is best to work with a Pennie certified broker, because those brokers on market and off market can help the customer research plans that, number one, are in their market and would best align with their needs as a patient, what their needs are, and make sure that that health insurance that's purchased, again, whether it's on marketplace or off marketplace, making absolutely certain that that health insurance that's purchased aligns specifically with that customer's needs. So,
Gotcha.
and Asia just asked the question, are brokers medical professionals? No. We are licensed professionals through the Pennsylvania Insurance Department to sell health insurance within the Commonwealth of Pennsylvania. And we are the only licensed professionals who can do that.
Got it. And one other question, Scott. In terms of actually signing up for the insurance,
Yep.
an individual can sign up through a broker or on their own.
Yep. And I'm about to show you that.
Okay, perfect.
Yep.
Thank you.
Okay.
Sorry to jump ahead.
No, that's okay. One of the things I wanted to do, though, while we had time, is I wanted to show everybody how easy it is to compare plans. Okay. And right here, we've got 3 plans side by side. These are all silver plans. These are all silver HMO plans. Okay. Now, what I'm about to show you, again, please keep in mind, any broker, any assister, a Pennie customer service rep, you as a community partner helping someone can do what I'm doing here. Okay. This is very, very easy. You can go in, you can hit compare now. Now, this is where we really get into the good stuff. Okay. We can compare prices, obviously. Okay. So we see where Independence Blue Cross stands. We see where Oscar stands. We see where AM Better stands in terms of pricing. They're all HMOs. If we don't understand what an HMO is, all you have to do with this is hover over where it says HMO, and it explains to you what a health maintenance organization is. Again, we are trying our very, very best to take all of the fear out of health insurance. We're not demanding that people provide us with this, that, and the other thing before they can look at this type of information. And this is valid information. In other words, what I'm showing you here, if this same person picked up the phone and called a customer service representative, if this same person went to a Pennie broker in their community, they would see the same exact plans. The only difference is they can go through here. And again, you remember before when we said, hey, you want to make sure if before we got into the comparing of plans, do you want to make sure that we can, identify your family physician or your personal physician, that healthcare provider that you have a relationship with. We can click here and we can add that information. Okay. But more importantly, we take a look at our drug deductibles. We take a look at, whether or not there's any separate drug deductible, our out-of-pocket maximum. What does that look like? What does it look like if we visit the doctor, a primary care visit? There's a $25 copay here. There's a $40 copay here. So those are important because they can add up, especially for somebody who might, visit the doctor, 5 or more times a year. But here is another thing. Here's information related to generic drugs, prescription drugs, etc. Outpatient services. urgent care and ER care, hospitalization. Here's an incredibly important one with regard to mental health and substance abuse disorder coverage. That is important. Again, you can't be denied coverage through Pennie due to a pre-existing condition. That's an important thing for folks who work with those who are challenged with substance abuse disorder. And of course, we go into child vision, child dental, and some other related, everything from, acupuncture, we can check and see if that's covered, allergy testing, diabetes education. The long and short of it is you can get into some very, very detailed information here. Some of the information you will have to get through the carrier though, again, and that's where a broker can come in, because brokers can pick up the phone and call a carrier directly and say, hey, do you cover this, this medication, or do you cover this procedure? So please know that Pennie certified brokers they're the best of the best. But before we break for a couple questions, I also want to stress that Pennie sells dental insurance, and we have good dental insurance plans. These are the dental insurance plans that would be available for the individuals. And again, our dental insurance plans are set up so that you can compare them. Knowing that, orthodontia is very important to a lot of families, that is something that you can, see that, yes, indeed, this is, 50% coinsurance after deductible. You're there. So it's, you can make sure that, all those items are included. I also want to, point out that there's a plan brochure here that a person can be directed to, provider directory. So when it comes to dental insurance, you can do the same thing in terms of making sure that your needs are met. If here, I'm going to go back here real quick just to change this up a little bit. There was another zip code that was up in here. Here we go. I'm going to try this other zip code, 19525.
Scott, before you
Yeah.
got into the next zip code, there was a question about the tax credit versus the subsidy and how the tax credit works in connection to monthly payments. To access the credits, would an individual need to navigate the tax process to get the cost reduction after the year, or would it be automatically reduced in the monthly cost?
Well, an advanced premium tax credit is something that customers have 100% control over. Okay. One way of looking at it is a tax credit. Okay. But the advanced portion of it is that they can take advantage of it, right now in their first month's health insurance payment. Okay. So that's the advanced part of it. You're actually
right. So it can reduce the premium that's paid out each month, and then there's some sort of form and accounting for it at the end of the year to say, hey, you already got this tax.
Right.
Okay, and that gets filed.
Yep.
With your taxes.
You reconcile that on your taxes, which again is a standard procedure. That is something that people, and when I say there are a couple ways people can work with it, let me explain that. The first is you can take 100% of your advanced premium tax credit right now and utilize it through the year, each month, paying the portion per month. Okay. And in fact, I'm going to go back down here just so that I can take a look at this. The advanced premium tax credit that you see on your screen right now reduces this individual's payment by $430 a month. Unless otherwise specified, it will be applied at $430 a month to their premium. Now, I say unless otherwise specified in that individual has the ability to say, well, I only want to utilize 80% of it. So they can reduce that 430 to only 80% of it, and they keep 20% in reserve. And what happens is when they reconcile their taxes, if they overestimated, might have to, pay back some money, they'll have some protection there. For other folks, if they, underestimated, most definitely they'll get a refund in that amount, whatever that would be. And then of course there's the third option, which is not something that a lot of people do, but they may be in a position where they would opt to use no advance premium tax credit, pay full price for their insurance at a monthly premium of whatever that may be, and then get their refund back when they reconcile their taxes. So that's what the advance premium tax credit is. It is a very standard form of financial assistance, but it really makes a huge difference.
That's great. Can I just, I'm watching the clock. It's 1:28.
Mm-hmm.
I think we probably need to wrap up before doing the additional example in the new zip code.
Yep.
But I have to say, just to, having looked at the exchanges when they first came out years and years ago, the national exchange that had all that trouble launching, the amount of information that has to be pulled together behind the scenes here to understand eligibility, and then to understand on top of eligibility, the pricing, and be able to put that out there well, and all of the right subsidies and tax credits. Amazing what the guts of this has going on to deliver really clear, clean information and options to consumers. So kudos to your team for pulling this together so well. It's really, really an impressive website, and I know you guys managed to do it all during COVID. So that's just amazing and wonderful.
Yeah.
And yes, Christopher pointing out it's so much easier to use than the old exchange. Yes.
That's music to my ears, Christopher. That's music to my ears.
I think we need to wrap up. Thank you all of the attendees for your time and attention, and for all the good work you'll do. Scott did share his contact information, so if you have follow-up questions, please do follow up with Scott. And Scott, thank you not only for all of the wonderful information, but your very clear enthusiasm and commitment to this really important work. The Commonwealth is well served by you leading this outreach effort. So thank you so much.
All right. Thank you, and everyone be safe.
Thank you all. Bye-bye.